Hi, my name is David Pearson, and I am a radiation oncology medical physicist. In this presentation, I'm going to talk about medical physics as a career. I'm going to focus a little bit more on radiation therapy, but I will mention the other areas that medical physicists do work in within the clinic and within industry. So let's get started and talk about, first of all, what a medical physicist is. Just like everybody else, every once in a while I get asked, what do you do for a living? What is your job? And I reply, I'm a medical physicist. And very often I get blank looks and confusion from people I'm talking to because it is not something that a lot of people know about. So what exactly is a medical physicist? This is actually a pretty difficult question to answer because it depends a lot on what the person does with their medical physics training. Do they work in radiation therapy, or do they work in diagnostic radiology? Do they work for industry? But as a very broad sense, a medical physicist is someone who specializes in the application of physics to help people in medicine for the diagnosis and treatment of diseases. Medical physics can be thought of as being a bridge between physics and medicine. We need to know quite a bit about physics, but we also need to know quite a little bit about medicine as well, especially as how it applies to our specialties. So for example, as a radiation therapy physicist, I do need to know at least the basics of how radiation therapy works at a biological level, how the radiation interacts with cells. I need to know a little bit about how patients are going to be treated so that I can identify when there's problems if a patient is being treated in an unusual or dangerous way. There are many subspecialties, or there are a handful of subspecialties of medical physicists. As I mentioned, I'm a therapy medical physicist. I work in radiation therapy. There's also quite a few people that work in the diagnostic side, working with radiology departments in imaging, and there are people that work in health physics and in nuclear medicine. I'm going to concentrate most of this talk on radiation therapy simply because that is my specialty and that's what I know the most about. I'm not really qualified to talk about the other specialties. A medical physicist within the radiation oncology department can be expected to play a significant part within a team of medical professionals whose job it is will be to safely and accurately deliver radiation therapy to patients, often cancer patients. Let's talk a little bit about the roles of each of the person within the physics department, within the radiation oncology department. Obviously, there's the medical physicists, and we're going to talk about more about them in detail. But let's talk a little bit about the other people that work in a radiation oncology department. You will find that there is a radiation oncologist, a physician with an MD or equivalent degree who is in charge of the care of the radiation oncology patients. Their job is quite easy to describe. Their role is to care for the patients, prescribe the radiation that is necessary, and basically to tell the people on the care team where the cancer is located and how much radiation the patient should receive. And then the other people in the care team that we will talk about will help treat the patient and decide how best to get that radiation to the disease. Medical dosimetrists are often the people that design radiation therapy plans. They typically have a master's level degree in designing treatment plans. Physics assistants may be people with less qualifications that are maybe working towards becoming a qualified board certified physicist and are in the process of getting job experience by helping out in a radiation oncology department. Radiation therapists are very important frontline medical professionals who operate our treatment machines. So typically radiation is delivered by high energy linear accelerators that create X-rays that are then delivered to the patient. The radiation therapists are in charge of making sure the patient is set up correctly on the table, on the treatment table, underneath the beam of radiation, and they're the ones who are ultimately going to trigger the radiation and start the treatment. There needs to be nurses in radiation therapy who specialize in the care of radiation therapy patients. And there are often nutritionists who can help with making sure that patients are actually getting proper care. So for example, if a patient has esophageal or stomach cancer, they're going to need, a nutritionist is going to need to work with that patient to make sure the patient is not losing weight at a dangerous rate. And then, of course, there are other people that work in a radiation therapy department, such as the front desk who schedule our patients, and administrative staff who do a very important job of supporting us. Now let's talk a bit about why you might want to become a medical physicist. If you're interested in physics, but you're also hoping to apply that physics in a way that's going to help patients, then you are going to get job satisfaction from being a medical physicist in a radiation therapy department where your skills get to directly influence the care that is given to radiation therapy patients. It's also a challenge. For me, my day-to-day activities are quite varied. I'm involved in quite a lot of different aspects of radiation therapy and also administrative tasks for the medical school and for the university as a whole. So every day is a challenging, and there's often new things that pique my interest so that I'm not doing the same thing over and over again. And the final thing that's probably going to be important to some people is that the compensation, the pay, is pretty good. After obtaining a degree in medical physics at the graduate level, whether that be a master's degree or a PhD, both of which the University of Toledo offers, you're going to need to do residency. Residents are actually paid. Typical resident salary is of the order of $50,000 per year. And you can expect that that's going to be for about 2 or possibly 3 years. Again, the University of Toledo has a radiation therapy residency for medical physicists, and it's a two-year degree, and we pay between $50,000 and $55,000 per year for those 2 years. Once a resident graduates, they can expect a starting salary of around about $150,000. This is for someone with a 2-year master's degree and a 2-year residency. For such an important job that directly affects the care of patients, as you can imagine, medical physicists have to be qualified. That means more than just doing a degree and taking some training. It means that you're going to be assessed for your clinical competency and tested to make sure you're safe in a clinical environment. This is necessary if you want to work in a clinic, although I will mention that there are jobs for people that don't want to work in a clinic and who would prefer to do either just research or teaching or work in industry and not be directly responsible for patient care. But if you do want to be responsible for patient care, how do you become a qualified medical physicist? For us in the US, this means becoming board certified by the American Board of Radiology, or at least that is the most typical pathway. In order to become board certified in radiation therapy, you will need to complete an exam or a set of exams that allows you to become board certified. The first step of the exam is called Part 1 for obvious reasons, and it is generally taken while you're in the graduate program. So for students at the University of Toledo, for example, in the master's degree program, it's typically taken between year 1 and year 2. If you don't pass it on the first attempt, that doesn't mean you get kicked out of the program. You can still pass it in the future. In fact, you can take it within the next 2 years without actually suffering any delay in how long it's going to take to become board certified, because the second part of the exam is not taken until after you've completed residency. So that's going to be about 3 years after taking the first part of the exam. The final part of the exam, Part 3, is actually different from the previous two, which are computer-based exams. Part 3 is an oral exam. So Part 3, you will actually sit in front of an examiner, and the examiner will ask you a series of questions pertinent to radiation therapy medical physics. Once you've done that, you will become American Board of Radiology certified, and that is how you will demonstrate to your employers that you are qualified as a medical physicist. It is possible to become, and in some states required to become, licensed within a state. So for example, Ohio does not require a license. It just requires board certification to be qualified. But a state like New York does require a license. If you have board certification, getting licensed to work in that state should not be difficult. The American Board of Radiology should make it quite easy for you once you've become certified. I will also mention that becoming board certified is not a one-stop process. You'll go through multiple years of taking those 3-step exams, but at the end of the day, becoming board certified does not mean that you can stop and no longer learn anything new in radiation therapy or let your skills dull. You will actually be required to answer questions periodically. I actually have to answer questions every month to be able to maintain my certification. It also means I have to go to conferences and listen to talks and keep up on what is happening in radiation therapy. I actually have a separate video on the topic of how do you become a medical physicist, specifically in radiation therapy and working in the clinic. But I'll lay it out just very briefly here. First of all, it helps to have a physics degree. It's not absolutely required to be a physics major, but a strong background in physics is going to be absolutely necessary to get accepted into the next phase of the process. Training for radiation therapy physics starts in graduate school. You don't have to have any experience previously in radiation therapy. Although I should mention that at the University of Toledo, there are some courses that are offered in medical physics, so you can learn a little bit more about the topic of radiation therapy physics, and those things will help you get accepted into a graduate program for programs that are looking for experience. The next step is going to be that graduate program. So graduate programs, I mentioned in my other talk, is a master's degree, a professional degree called a DNP, or a PhD. The vast majority of people in the US will do either a master's degree and become clinical medical physicists, or a PhD and do a combination of clinical and research and teaching in academia. Before you can work in a clinic, you also have to do a residency program. Clinical training is not included, at least not sufficiently, in a master's degree or in a PhD program. So even though those programs may include clinical experience, you're going to need to get formal radiation therapy training in a residency program. Residency programs are typically 2 years, and as I mentioned, they are paid starting salaries around about $50,000 for a medical physics resident. And then following this, or at least in parallel to this, you will be working towards your board certification. Part 1 taken during graduate school, Part 2 taken just after you finish residency, and then Part 3 within 1 year of finishing all of your training. As I've mentioned, medical physics is split up into multiple different disciplines. The one that I'm going to talk most about, or have been talking most about, is radiation therapy. The reason I'm talking about it is because I work in radiation therapy, but it also helps that radiation therapy makes up more than 3/4 of the job market. So although there are physicists working as medical physicists on other fields, about 3/4 of them are working in radiation therapy. The reason for that is because medical physics skills are required a lot in the field of radiation therapy. There are a number of things that we have to do, which I'll talk about in a special talk specifically on what medical physicists actually do. To give you some idea of how many medical physicists there are in Toledo, by my estimation, there's about 15 medical physicists just in radiation therapy alone at the University of Toledo, at Flower Hospital and other ProMedica sites, at Mercy hospitals, and just around this region. There's probably about 15 medical physicists working in radiation therapy departments. There's probably about 5 or possibly less working in diagnostic medical physics and other related fields like health physics. The primary responsibility of radiation therapy medical physicists is the clinic, making sure that everything is working well in the clinic and that patient treatments are going safely, accurately, and efficiently. But medical physicists, especially those with a PhD or working in an academic medical center, will also be involved in things like research, education, the teaching of other medical physicists, the next generation, and also regulatory compliance. And we'll talk a little bit more about these separate topics. Based on a professional survey of medical physicists, the vast majority of medical physicists do work in clinic. And again, it makes up over 3/4 of all of the jobs that are available for medical physicists. There are, of course, some people that work purely in academia, although a lot of us will actually work both in academia and clinic, so work in research, work in teaching, and work in the clinic. There are some medical physicists that work purely in administration, and there are medical physicists that work for government bodies and are involved in regulatory requirements to make sure that the states or the United States all have rules and regulations that medical physicists and other professions that deal with radiation would have to follow. There are other professional medical physicists that work in product development, in research. We use a lot of very advanced technology in the field of radiation therapy, and someone has to design that technology. And as you can imagine, medical physicists are at the front and center of making sure that that technology reaches us as quickly and safely as possible. Are these clinical responsibilities that I've spoken of? What are the day-to-day services that a medical physicist can expect? Well, a typical day for me will involve working with our students and residents, but in a clinic that does not have students and residents, medical physicists will supervise the design of radiation therapy treatments. They will check to make sure that patients that are currently under treatment are being delivered accurately and correctly by reviewing the records that are stored in the medical record system and making sure that everything is going exactly as planned and as the treatments were designed. Medical physicists will often be responsible for making sure that the radiation therapy equipment is actually working correctly. So that would mean things like testing to make sure that the output of our X-ray machines, our linear accelerators, is accurate and that we're delivering dose accurately. And there's a number of mechanical and imaging tests that our machines have to test that have to be done on them. Overall, it's actually a few hours of work that has to be done every month to make sure that our machines are within regulatory compliance. We are often involved in dose calculations as well for patients. So again, that's part of the treatment planning process. And we will often liaise between other healthcare professionals to make sure that our physicians have all the information that they need in order to accurately deliver the radiation. So what else might we do on a day-to-day basis? So I've mentioned the reviewing treatment records, reviewing images at the treatment machine. So we'll often have to go down to the treatment machine to actually check to make sure a patient is in the correct position. For certain types of treatment, I actually have to be present for that treatment and make sure that everything is going as planned. We will sometimes be involved in patient education, which means directly interacting with patients and talking to them about what to expect. And in some cases, there may be things that they can do to make sure that the treatment that they are receiving is as accurate as possible. So we sometimes do patient education and sit down and talk to the patients about what they can expect. We're often involved in the use of radioactive materials to treat cancer. So far I've mentioned that we use linear accelerators to generate X-rays that will deliver radiation deep inside the patient. But sometimes it's actually possible to put a physical source of radiation directly in contact with an area that we are trying to treat. And so this is called brachytherapy, and it's something that a lot of medical physicists are involved in. If there's any special procedures in radiation therapy, we are likely going to be involved in those as well quite closely. There's some special things that we will do, things that we don't necessarily do on a day-to-day basis, but it's part of our jobs. For example, if a new radiation therapy cancer center is being built, the person responsible for making sure that the walls are adequately shielded so that the radiation is staying where it's supposed to will be on the qualified medical physicist. If a radiation therapy center buys new equipment that generates radiation, then we will be responsible to make sure that that equipment is tested and appropriately accepted before it gets put into clinical use. As I mentioned, radiation therapy departments typically include vaults or shielded areas where the X-ray generating equipment is stored. In the case of radiation therapy departments, these walls have to be very, very thick because the radiation that's being generated is extremely high energy. Typical treatment of cancer using radiation will use beam energies of X-rays of the order of 6 to 18 mega electron volts. These beams can pass through quite thick walls of concrete, and so our vaults have to be shielded such that we can be outside the treatment room and get practically no radiation, no more radiation than someone who is just working in a non-radiation field. It does mean that we tend to wear things like radiation badges that will alert us to any radiation that we do receive. But I've never actually had a situation where I've been exposed to a dangerous amount of radiation, and part of that is because we do such a good job of making sure that our radiation machines are adequately shielded. So this little picture here shows a schematic of what a radiation therapy vault might look like. In the center of the vault there is the treatment machine, and then there is often a maze so that the beam of radiation cannot point directly at the door. As you can imagine, the door needs to be also shielded, and so the doors are quite heavy and typically require mechanical devices to actually operate them. One of the most exciting things that we will do is commission new equipment for use in the clinic. So every 5 to 10 years, just like a laptop may still be working but becomes obsolete, the equipment that we use in radiation therapy also starts to become obsolete. It may be functioning just fine, but newer and better equipment is available on the market, and of course we want our patients to get the best possible care. So every few years we're going to buy a new model of linear accelerator. This is what the linear accelerator might look like with the covers taken off. This is actually our treatment machine, or one of our 2 treatment machines, with the covers taken off. And this is what it looked like when we first bought it. The acceptance of a new machine is a big job for a medical physicist, and typically takes weeks and weeks of actually making sure that the machine is doing exactly what it's supposed to be doing. And then we need to take a lot of data that we will put into our computer models that we will then use to design the radiation therapy treatments. So it's a big job. It's not something that we have to do very regularly, but when we do partake in accepting and commissioning new equipment, it's a pretty exciting time. Not all medical physicists will work in an academic setting. The majority of medical physicists will work in a radiation therapy clinic, but not necessarily an academic one. So for example, a number of my colleagues work at Flower Hospital, and they're involved in patient care, but they're not necessarily expected to teach graduate students. Although we do actually have a resident that is there all the time to learn from them in the clinic. But in terms of teaching classes and things like that, these are not things that medical physicists will be expected to do unless they work in an educational or an academic setting. The University of Toledo does have graduate programs and residency programs, and therefore as medical physicists, we're expected to teach our students so that they will learn how to do the job that we have. So teaching in a graduate medical physics program and a residency program is a very rewarding part of my job. It is not something that I would wish to give up. I don't think I would actually want to work as a purely 100% clinical medical physicist. I actually like having the responsibilities to also take care of students and residents. It also makes my day a lot more varied because I'm not going to be just repeating the same thing over and over again on clinical plans and just the clinical aspect. I'm also going to be involved in training, and it also means I get to work with some great people, and I make many friends who are going to be working as medical physicists in the future. Medical physicists also may not be required to do research, but if you work in an academic setting, or if you work in a clinical setting and it's just something that interests you, you will have an opportunity to do research. radiation therapy is a constantly evolving field. Every year there's something new that we need to learn, and there's something new that we can implement into our clinic. Often those new technologies, those new techniques come from academic physics, academic medical centers like the University of Toledo, where we not only stay at the forefront of technology and innovation, but we also contribute to it. So there are opportunities for medical physicists to get involved in research. I know some medical physicists that actually don't work in academic centers, but they actually just want to contribute. Even though it's not part of their job requirement, they will still be, working on research and publishing papers. So it's something that any medical physicist can do. But if you want to do it as part of your career, it's probably going to be best to get a PhD in a PhD in physics as opposed to the master's degree that we talked about. The kind of stuff that we might get involved in for radiation therapy research could be working on new technologies, working on new treatment techniques. We have implemented a number of new, or contributed to a number of new technologies in radiation therapy, and our department has patents that are used in the field of radiation therapy. So these are things that, again, if you're interested in research, then you will learn more about that in graduate school and residency. So hopefully you found this presentation useful. If you have any questions, feel free to reach out to me via email. And of course, always feel free to follow us on Twitter and look at our other educational videos that we have on YouTube. And hopefully I'll see you again soon.